think, yeah, welcome to everyone. I think we're going to get started now. Just really grateful for everyone being here today for this really important community conversation. Before we begin, I'd like to introduce myself. My name is Dr. Shelley Cook, and I am the new Executive Director of Community Social Planning Council of Greater Victoria. And this is actually my first event in the role, and I'm just really thrilled that this is how it begins. I would like to thank our Community Social Planning Council team for their work in organizing the event, our panelists, of course, the others you'll be hearing from today who are offering their important perspectives, and of course, everyone who's attending today from across BC and Canada to learn about London's successes in responding to issues of homelessness. I have a long history of working in communities across BC and Ontario, developing service responses addressing the social determinants of health with a focus on homelessness and conducting community-based research to inform homelessness service and policy responses. And I'm just so pleased we're having this conversation today. In British Columbia, we've seen a 140% increase in deaths of people experiencing homelessness over the last 2 years. That is an average of approximately one person a day in BC who is dying on our streets. When it comes to addressing issues of homelessness, inaction and ineffective action can truly be measured in lives lost. This event is part of Community Social Planning Council's effort to convene important community dialogues that lead to meaningful solutions to address complex, wicked social and health-related problems like homelessness. Community Social Planning Council acknowledges the Songhees, Esquimalt, Sortlip, Secum, Selwyn, Pakachin, Suk, Sianu, and Pachadat nations who have historical and ongoing relationships to the land where our offices and our work is based. Again, as today's conversation on homelessness and a whole of community response is national in scope, I want to recognize that people are joining from a variety of locations in different contexts, some from lands that are unceded, some from treaty territories, both urban and rural, and so on. Historic and ongoing colonialism deeply impacts our conversation today, in part because ultimately this conversation is about how we care for and respect one another. I encourage all of you to use the chat to introduce yourself and the territories that you're joining from. And finally, I would like to add that this conversation is simply the first of many we hope to have working with our important community partners. And we'll always, and as always, we benefit from a diversity of voices and perspectives. And today's wonderful lineup of speakers is certainly an example of this. So to give you a sense of how things are going to work, today's event will begin with a brief overview of our local context being provided the Southern Vancouver context, before moving into a presentation from 4 speakers who have been deeply involved in London, Ontario's whole of community systems response to model of homelessness. And following that, we've convened a really great community response panel to first offer their perspective on what they're hearing, and then ask a pointed or general question of our London guests. Certainly, we encourage everyone to use the chat to ask questions, and where possible, our panelists certainly will respond, but we do want to recognize that we may not have time for all the important questions that will be in the chat. The Community Social Planning Council is a nonprofit charitable organization that leads community planning with a focus on promoting equity through programs, research, and community engagement. And this is really just an example of our important work. So I'd like to introduce Erica and really our partnership with the United Way to ground us in the local context. Erica is here, and she is the Executive Director, United Way of the Southern Vancouver Island. So our partnership, this is one of these rare partnerships, and that goes back so many years. And it's really a testament to the power of collective action, tracing actually our roots back to the Great Depression. So this long-standing collaboration serves as a foundation for Community Social Planning Council's Happiness and Wellbeing Lab. And really, we think about that as a project where past meets the present to shape the future of community wellness in the capital region. So we're really, really excited about that project and really happy Erica could be here today. So United Way is just not a funder, they're a true partner in this endeavor. And with that, I'd just like to turn it over to Erica and thank Erica and United Way for being involved in our event today.
Well, thank you, Shelley, and thank you to your team for their partnership over the years. I joined the organization a year ago, January 2nd, and I've had nothing but great experiences working with the Social Planning Council's team and learning about the long-standing partnership from my colleague Danella on my team. I'm very grateful for the opportunity to participate in this webinar and learn more about London's innovative response to homelessness challenges in their region. We all know affordability, or rather unaffordability, of life of people in Southern Vancouver Island is a hot topic in conversation. We're all feeling the pinch of increasing costs, from mobile phone plans to mortgage rates to groceries. It's expensive out there. And alternatives like getting an EV instead of a gas-powered car or renting instead of homeownership are out of reach for many, many people in our community. These are the conversations about housing that are getting the most attention with my colleagues and actually with my family and friends. So it's everywhere. Everybody's talking about this. I have 4 children, and they're not little anymore. 2 are in university. All 4 live at home, and they do that because of the cost of living. And because I don't want them to go and I'm their mom and I'm not letting my fingers off of them yet. But a lot of it has to do with that cost of living. My oldest, who's 20, did a scan of housing, and the first place that he thought he might be able to afford was in Nunavut. And so that leads us to our conversation today. Our host for the webinar, the Community Social Planning Council, is one of our secret weapons at the United Way. They consistently provide us with stats and data to reflect the critical social issues in our community. For me and others, their reports are often the kind of catalyst for serious discussion, whether with friends, policymakers, or just about social issues. On the topics of affordability and homelessness, they provide valuable information to help us understand real-time lay of the land stuff here, right on Vancouver Island, Southern Vancouver Island. Consider the living wage, the hourly amount a family needs to function, stay healthy, and contribute to the community, rose more than 30% between 2021 and 2023. Applications to the rent bank have increased overall this year, many from single-person households, newcomers, and people awaiting their EI benefits. And heartbreakingly, there are a record number of families with children and seniors accessing food banks in our region. That just hits me home as a person who has senior parents and children at home. It makes my heart hurt. Homelessness continues to be a real social issue for us locally. The last point in time count identified more than 1,600 people, either sheltered or unsheltered states of homelessness in our region. And our communities are more than just that. Our communities are made up of everyone who lives here, whether housed or unhoused. And in our communities, we all know someone who is vulnerable. We all know someone who is dealing with the consequence and impacts of unaffordability. They even may be hiding from you, but I bet you know somebody. It's clear that affordability, especially related to housing, is a major problem in Canada, and it contributes to homelessness. We have to stop for a moment and start looking at our community challenges differently. And Shelley sort of touched on this off the top. What we've been doing is not working. As a society, we are conflating issues and expecting a one-size-fits-all solution to everything. We also look at a solution puzzle of interconnected issues and pick out a couple of pieces without recognizing the whole picture. So where do we go for solutions? Who's trying to do something different? Or better yet, who has policy and data that they can share with us? It's in my professional interest to hear what's going on today, and it's also part of my nature to be curious and optimistic. And so I'm very much looking forward to hearing about the collaborative dynamic in London as a response to this issue and learning about the network of hubs. I can say that in principle, it's right up my alley, as creating networks is at the core of what we do here at the United Way. We convene conversations, diverse groups to discuss social issues, support an interconnected network of local service agencies. And I welcome this opportunity to learn more from those in London about their whole community systems response. So Clearly, this is a important conversation. There's no sort of challenges, but without further ado, I want to take us through who's joining us today. So we have Lynne Livingstone, the City Manager of the City of London, Ontario. We have Kevin Dickins, the Deputy City Manager of Social and Health Development at the City of London, Ontario. Diane Silva, the Director of Philanthropy at the London Community Foundation, which administers the Fund for Change in London that supports this important work. Steve Cordes, the Executive Director of Youth of Opportunities Unlimited, which is one of the operators and one of the first hubs in this program. After they do their presentation, we will bring in our local response panel to share their perspectives and ask some questions. And on our response panel, we have Leah Young, the Director of Housing and Shelter at Our Place. Krista Loughton, the City of Victoria Councillor and Documentarian. Sylvia Cizit, I said I would get this right, Sylvia, and I still got it wrong. Sayasero, the Executive Director of Alliance to End Homelessness in the Capital Region. And Hilary Marks, an experiential community advocate here in Victoria. So without further ado, I will step off and turn off my mic and hand it over to these important speakers today.
Lynn or Kevin, if one of you wants to unmute yourselves, you can let us know if you need any tech support. I just can't hear you right now. Okay.
Lynn may be looking for the share screen. Her mouse is not working. Okay,
Kevin, do you think you can?
working on that.
Okay.
You know, can you hear folks? My apologies.
Okay, I got it.
Very good. All
Yeah.
right.
Is that you sharing, Kevin?
I'm going to stop though. There you go.
Okay, I apologize for that, folks. We'll get right to it. Okay. Can you see one slide or a bunch of slides? Two.
We can see your screen. It's in presentation mode, so we can kind of see one slide twice.
That
So if
better?
you do,
Is that better?
I'm still seeing 2 slides on my end, but whatever you did before the meeting started worked really
That better
nicely.
now? I'm sorry, I'm having real problems here.
That's all right. We can still see the slides. When Kevin had shared his slides, there was that was working in kind of the ideal presentation mode. So I'm not sure if you'd clicked a different setting, but it was only showing us one slide.
What do you see now? One or two?
We've seen the same thing the whole time.
Okay, so mine's not working, Kevin. You need to share. I apologize, folks. This worked earlier today.
And it looks like I'm having the same problem.
If you go to the display settings.
There we go.
Beautiful.
Yay, all right. That's teamwork. That's what Kevin and I have done for the last 18 months, troubleshoot any and every problem we've had in front of us to try and address our health and homelessness crisis. So we appreciate very much your patience with us on setting that up. And Kevin's going to help us move through the slides, and I'm going to kick us off. So thank you very much. On behalf of myself and my colleagues from London, we really appreciate the opportunity to be with you today and share a little bit about the work that we've been doing together in our community to try and address what is quite a significant health and homelessness crisis. So if we go to the first slide, what I thought I would do is begin with why we even began talking about this and why now. In fall of last year, it became very apparent. Anyone walking through London could see that we were dealing with, and we continue to be dealing with, a very significant health and homelessness crisis in our community. We were hearing it from neighbors. We were hearing it from devastated frontline workers. We were hearing it from businesses. And just to give context to some of what we've been facing, and it sounds like it might be a little bit similar to what I heard in the introduction, but since the beginning of 2020, we've had more than 260 unhoused Londoners die on our streets. This is very significant. In 2023 alone, that number was over 65. So very significant impact to individuals suffering and dying on our streets. Not only were we having that, we are also seeing quite a jump in the number of people who are living unsheltered in our community. We are, on any given day, approximately 2,000 folks living unsheltered in our community. The number prior to the pandemic was about half of that. Also, what we were seeing was a very significant increase, not just in the increase in number of folks living unsheltered, but increase in the number of individuals who had the most complex needs. High acuity is the language we use, and we're talking about those with very serious physical health, mental health, substance use issues. This is why we stopped talking about this as a homelessness crisis and started talking about it as a health and homelessness crisis. So again, we were seeing a significant jump in the number of folks living unsheltered and a significant jump in the number of people with the most complex, highest acuity needs. In terms of the impact, what that meant on a day-to-day basis and the impact to our community, our paramedic services were responding between 10 and 11 times per day to those who were unhoused. Significant number of folks, and you will be experiencing the same, showing up in our hospitals, in our acute care beds, in our emergency department. In 2022, we were looking at 6,300 emergency department visits alone, and with a number of those folks being admitted. In addition to those very serious frontline health impacts and expensive health impacts, we are also seeing a number of our businesses closing between a combination of the impact of the pandemic and very significant community impact of the number of high acuity folks on our streets. And we were starting to see encampments spread across our community. Prior to the pandemic, they tended to be located in and around our core and close to our river. But if you were to look at a heat map today, you would see them in all areas of our community. So that is what we were seeing in the fall of 2022. And a number of us were starting to say, what are we going to do about this? And so what we did was bring together anyone and everyone who expressed a concern. And we, if you want to go to the next slide, Kevin. We started to create what we called our Made in London solution. So this is our first summit on November 9th of 2022. And why I'm showing you this picture, one, you can see that there's lots of folks there. But what I want to say about this is the folks that were in this room, we had what you would expect in terms of social service organizations and community health organizations who are already in the space doing the work. But for the first time ever, in addition to those folks in the room, we had our institutional health leaders, we had business leaders, we had our developers, we had our university, our colleges, all levels of government, folks with lived experience, frontline folks, all in this room. And we came together, if you want to go to the next slide, Kevin, to really begin the conversation about having an honest discussion about what was happening in our community. And so it was looking at the numbers that I just shared with you. It was talking about what we're currently doing. And I heard Erica say what we're doing now isn't working. That's exactly what we said on November 9th in 2022, a real honest recognition that what we were doing collectively wasn't working. And for some of us, particularly those of us at the city, we needed to state publicly that what we'd been doing in the past, not everything was working anymore, and perhaps mistakes had been made. And I think it was very important to recognize that we needed to think differently, show up differently, and be different. And that was quite important at that first summit. In addition to understanding the picture, we took a look at best practices, what was working well in our community and perhaps small sectors, and what was working elsewhere. So as the slide said, we started to learn from each other, we listened, and we began to lay a foundation to begin to build trust and talk about how, if this isn't working, what should we do differently? That led to the next summit that happened the following month in December. This is folks sitting down to work very hard at, okay, we know what the problem is. We have some idea of some things that work. How can we start to create a system? What are the elements of a system that would work for the individuals that we're talking about? And I should state that we made a very clear decision. We have a wonderful base system of shelters, of frontline outreach. What we aren't doing well is serving those who are of the highest acuity. So we made a very concerted decision, very clear decision, that we would focus on those of the highest acuity, that's 600. So what are the things that those folks need to be able to be supported well? Next slide. So that led to our third and final summit in January of last year, where we said, these are the things that make sense. And we created what we call our whole of community system response. And it's based in two things. We say it is people-centered and housing-centric. And by people-centered, we mean, of course, the folks that are living unsheltered and need help and assistance. But by people-centered, we also needed a focus on those that are doing the hard work. Significant moral distress in our frontline workforce that needed to be considered and addressed as we try to do things better in our community. So people-centered and housing-centric. All of us know that housing is the key here, and so we really made that very, very clear upfront. And what our model is a network of hubs, and we'll talk more about those, where you can come to them from any point in the community, and they are purpose-built with a common set of core functions, low barrier, 24/7, whose purpose is to bring people indoors safely, help them to stabilize with whatever it is they require, and get them on that very clear and direct pathway to housing. So what we also hope by doing that is we're then able to have that place for businesses to call when they have someone struggling in their store or in front of their business, and also help to support the businesses in our core. We believe that by the model we're talking about, and we are starting to see this in smaller numbers as we begin, that we can start to reduce the stress and strain on our emergency response and healthcare services. And through all of it, start to increase that overall sense of safety and welcoming for all Londoners and our community. So that was what we were driving towards. We began with our shared purpose, and the fundamental tenet under our shared purpose, because remember, we're talking about this as a health and homelessness crisis, is we believe that housing is healthcare, and it is a fundamental human right. So everything we are doing is placing priority on bringing people inside safely, helping them to stabilize, and creating that very direct pathway and connection into housing or housing with supports. Very focused on whatever the individual needs to get them to that place. We do that through a set of principles that you can see on the bottom part of the slide, and those are very important in terms of us driving our efforts forward around how we're working together. So what that all looks like, this is our model. I like to think of it as quite simple. Essentially, we're doing two things. We are creating a network or system of hubs that you can get at through any of these referral doors that you see on the slide. We will have a one number to call. We heard that very clearly from community members, family members, and businesses in particular. They don't know who to call. Don't give me 5 numbers. I just want one. One number to call gets you into how we can help someone through the hubs. In the center of the diagram, you can see the set of core functions that are available and will be available at each and every hub. And essentially, these are all of the things that were identified. Not everyone will necessarily need all of these kinds of services and supports, but when we talk about those of the highest acuity, these are the kinds of services and supports that need to be available through the hubs so that people can begin that journey on stabilization and move into whatever level of housing makes sense for them. We know for this population that often begins with highly supportive housing. So that's the model that we are working towards. When we started with our plan a year ago, we said, sorry, Kevin, you were good. We said that we needed ultimately probably 10 to 15 of these hubs across the community. Each hub will deal with 25 to 35 folks, given the population we're talking about. We may not need that ultimate number, but that's what we said. Our goal was to have 3 to 5 up within the first year, and we are currently at 2. And we also, the other side of our plan around having highly supportive housing in place, over 3 years, we'd like to see 600 units. We were hoping to have 100 in the first year. We're at 69 and have more coming on very quickly. So this is where we have been working towards from concept to implementation. And so I'll just close my section to say, we know we're not unique in our approach in what we've been dealing with on our streets. We just heard very similar numbers and experience in the introduction. What we do believe is unique are a couple of things. One, the unprecedented level of collaboration that is occurring in our community with over 200 individuals and 70 organizations participating in not only the design, but now the implementation of this plan. We also have been very lucky to benefit from a generous donor family who has donated $25 million, not just to say, I want to help address this problem, but to this plan, which is extremely important. We have significant city commitment. The city has a backbone team. We have council endorsement of this work, and we have what I call an enterprise-wide team, meaning every department in my organization works to support this work. And we have a shared vision of what we need to do to help the most marginalized in our community. So with that, I'll turn it over to Kevin, who's going to pick up where we're at in terms of implementation.
Thank you, Lynn. And as indicated, it took a lot of work to create our framework of how are we going to create a whole of community response. And going from concept into implementation required the same level of deep engagement and really bouncing ideas off of so many different sectors and so many different interested parties. And what you see on the screen here is really what our implementation model was co-created to look like. And these concentric circles are all interrelated, and one doesn't happen without the other being engaged. But at the heart of this, at the heart of all the work that we're doing, is the experiences of those with lived and living experience. It's the voices of those that we're trying to support. We put the person at the center. And those that are currently experiencing homelessness have helped inform our hubs plan that went to council. They've helped inform what our highly supportive housing should look like. And their voice is supported and confirmed by the voices of frontline staff. And so our frontline staff have helped shape our shared values and principles. They sit and attend all of our various implementation tables focused on workforce development. We need to take stock of the current workforce that is, distressed and fatigued and burnt out. We need to look at how do we grow the workforce, what type of training is required. We have implementation tables focused on, yes, creating the hubs and those lead agencies, but highly supportive housing. We have reference tables that are geared towards our funders and the development community that create these properties, that own the land. We have a reference table from the business community that help us shape and give us guidance on how we can best support the businesses that are also feeling the impacts of this. We're supported by our strategy and accountability table, which is community membership, leaders from a number of different sectors, including healthcare and post-secondary institutions, as well as our nonprofit providers. Our city backbone team is the arms and legs that support all of these tables, be it our workforce development or our system foundations that looks at evaluation and research and how do we measure that this is working, all underpinned by our shared values and principles, all connected to our federal government, our local city council that endorses this work, our provincial government that often is the funder, as well as our local Ontario health team. And again, ultimately, we want to share this and we want this to be informed by our community. Our system development overview, this as a municipal government, it feels like we've been moving at light speed. And for some, we're moving too fast, and for others, inevitably, you're moving too slow. But we really, try to take stock. And next week will actually be the 1-year anniversary of our third and final health summit. But our summit process began at the tail end of 2023. We were able to finalize that system, the network of hubs and the core functions and the highly supportive housing. In February, we were able to get that endorsed by our municipal council, presented to the public in March. We began designing this implementation framework I just showed you immediately after that in March and April. And we found ourselves in the spring working with the community, doing numerous rounds of community engagement around what hubs should look like and where should they go, where should they not go, getting the voice of those with lived experience, frontline staff to help us design a hubs plan into May and June, and ultimately being able to take that to our council in July. And now we're moving right into, and we have been moving through the piece of funding it and standing it up and making sure we do an RFP process to get the lead agencies in place, all while trying to bring on highly supportive housing units at the exact same time, trying to build up the workforce at the exact same time, establishing an evaluation and measurement framework at the same time. So this has been a lot of work in a very condensed timeline, and these circles are not representative necessarily of the amount of intensified work that needs to go into it, but it is a demonstration of how we've been able to move this collective impact model and this community co-design work consistently throughout the calendar year. Our hubs and the purpose of hubs, as we've indicated, are to help people move into sustainable housing. We want to create spaces that are safe. We want to provide the opportunity for individuals to be stabilized, to receive that wraparound care, to be supported in ways that they're currently not receiving support. And again, we're focusing on the highest acuity population that's predominantly living unhoused every day. That's our group that is not welcomed at all the shelters, or they've been banned from certain service agencies. They're the most complex, hardest to serve. So we need to really create spaces that look, feel, and act differently to help those folks become stabilized, receive those supports, and ultimately be successfully housed. As we move people indoors, we understand that it needs to be unique to their needs. And you'll see in the coming slides, we need to meet people where they're at. We're trying to help people generate trust, trying to create pathways where folks will keep coming back, whether they're using a respite bed for a short period of time or whether they're in a transitional room and they might be staying for an extended period of time. Our goal is to help them access supports in that space as well as in the community, with the goal of recognizing that housing is healthcare. We need to help them become sustainably housed on their individual timeline. So every interaction is an active and intentional effort to enable an individual's next step, and whatever that next step looks like for them. Throughout this process, it's been important that we have intentional physical design. Intentional physical design that's been informed by frontline staff. How will this be safe to work in? Intentional physical design, both internally and externally, informed by those with lived experience. What do they need to see in a space that would create for them a pathway to come out of an encampment and access the services. So we need to facilitate that right space to deliver those core functions to this population while balancing the needs and expectations of the neighborhoods. We heard loud and clear throughout the summer we did about a dozen plus community engagement sessions that the neighborhoods do have concerns. There is a lot of unknowns. There's a lot of fear. And so we want to make sure that we are good neighbors, that we can help destigmatize this work for this population. And so it's important that inside service delivery is taken seriously, but so does the service delivery and the physical design of the space outside of the hub. We have instilled a very collaborative partnership model in serving and delivering services in the hubs. So we know that not any one agency can deliver all the core functions of a hub. It's going to take a whole community coming together to make sure we have an interdisciplinary, cross-sectoral, multi-agency model delivering services in these spaces. It's a network of service providers. We're integrating our expertise instead of creating silos and stops and starts and gaps in the system. A full operating model has been defined by lead agencies. We're applying those consistent set of standards and core functions. But we understand that there'll be things in a hub that are permanent, on-site, all day, every day. Then there'll be other, specialty services that might be scheduled or by appointment. They might come on-site, or might help facilitate the transfer of an individual to a specialty service. But it's fully integrated, warm transfers. We have services that might be timely on call, or services that are very exceptional, and then we might have to have better pathways for those referrals to help manage some of those waiting lists. Inside our spaces, and again, to meet people where they're at, we have collectively, as part of our system response, come up with a set of standards and core functions for the hubs, built on anti-racism and an anti-oppression framework, built on being culturally safe. It's an empowerment model, ensuring choice and care so the individual has some autonomy over the care that they get. Using a harm reduction approach, we are housing first, informed by the social determinants of health, gaining that input continuously from those that are living this experience of homelessness. Our core functions recognize that we have to have the delivery of basic needs. Lead agencies need to have active community engagement with their surrounding neighborhoods, creating pathways to income supports and housing access supports, integrated care plan, medical stabilization beds, access to that acute and primary care. Recognizing we need a mix of both the respite and transitional beds in each location. We've set out to focus on a set of core priority populations in our first 3 to 5 hubs, understanding that these make up the bulk of our priority or high acuity population. Our first 2 hubs are focusing on the Indigenous individuals, those that identify as Indigenous, as well as our youth populations. And a hub, we understand, may serve more than one of those populations. And as individuals come in the front door and access service, we may not be able to meet all of their needs or provide them the full suite of service, but we'll meet them where they're at and be able to help that warm transfer to another appropriate service. Throughout this process, we've done our best to be clear to other orders of government and be clear with our community, and relying on the expertise of all organizations around the projected cost of operating a hub. Knowing it's still going to be cheaper than hospital care, we run an estimate of about $2.7 million per year in operating costs, and we've been able to come in under that budget in the first iteration of this. But that's targeting roughly 25 to 35 beds with that collaborative multidisciplinary team. We've put in place staff ratios, again, trying to provide safety and exceptional care for this hard to serve high acuity population. And then also looking at trying to identify some capital costs for the properties, understanding we're not going to build new to move quickly. We can't just build from the ground up. So often there's retrofitting and minor restorations and alterations that need to happen in the physical spaces to be able to meet those internal design functions that we've set out as a community. So where we're at today, there has been significant progress. There has been a lot of community momentum. Lynne talked about the momentum. We're seeing a lot of interest from our other municipal partners across Ontario. We're seeing lots of community interest through the philanthropy and the fundraising that's happening. But right now we have two hubs that are up and running, and those lead agencies have been identified. The first hub is the LOSA Family Healing Services, and this is again a hub focused on, it's Indigenous led, supporting individuals that identify as Indigenous. It is actually based on the site of a hospital, as a St. Joseph's Healthcare, near their mental health hospital facility. A fascinating partnership, repurposing the land, repurposing hospital buildings, also introducing new transitional rooms and respite beds. They will have a combination of 10 respite beds and 18 transitional rooms, and coming in at an operating cost of roughly that $2 million per year. The other organization that we have operating one of our first two hubs is Youth Opportunities Unlimited, and I'll be handing this over to Steve next. But YOU, they also have a unique partnership where they're located on a different hospital on their grounds through London Health Sciences Centre. And YOU will actually be using two different locations to deliver their hub functions, with some of the respite and transitional rooms being on the hospital grounds, and some of the acute and primary care for youth being located in Jones Place, which is a fascinating housing opportunity for youth as well. And as that building finishes completion, the lower level will be used for the clinic space. And YOU anticipates that they'll be serving about 60 youth a year through this hub model. And with that, I will pass it over to Steve.
Thank you, Kevin. Lynne? So I want to dig a bit deeper into the model at Youth Opportunities Unlimited. Very briefly, what is YOU? Very, very briefly, it's a local not-for-profit organization, been around just over 40 years, with the intention and the mission of supporting young people between the ages of 16 and 29 around success in the labor market, success in the community more broadly, around their housing needs, run a variety of social enterprise programs, have a lot of partnerships with other community organizations and institutions. So the hub piece for us, part of what we do run actually with our housing range of services is also a dedicated youth shelter that operates as a low barrier youth shelter around 7 kilometers from our downtown, and has a 30-bed location. So when we looked at our response to the RFP and what we would bring to the table, we were looking for a couple key, I guess, pillars to our service that align with what you've heard from Lynne and Kevin. One is a healthcare partnership. We have a long-standing healthcare partnership with our local children's hospital, which is part of London Health Sciences Centre, with a project called No Fixed Address, which provides our staff providing in-hospital care for youth that are in patient care for psychiatric supports prior to their release to the community, so that we can ensure that there's a smooth transition and not a release to homelessness, whether that's into a shelter, whether that's into housing, reunification with family, whatever the outcome would be. So we want to build on, as Lynne said, health and homelessness. We would not have submitted an RFP, response to the RFP, if we didn't have a healthcare partner. And we're very clear with LHSC on that model, and they jumped in right away. So as Kevin said, the primary hub location that we selected is on London Health Sciences Centre campus. It's actually an underutilized building that has been sitting vacant for a period of time, where the permanent hub will be, with the 9 transitional beds and eventually the 6 respite beds. For now, so that we can offer services now rather than waiting for the organization to be ready and the new building to be ready. Our 6 respite beds are actually located within some meeting room space at our shelter. So within our shelter, we have a 30-bed shelter, all with individual rooms, but then there's also a common space where the 6 respite beds will do exist now as of December 1st. You'll see that under the bullet point, a couple of things about it. The service partnership with London Health Sciences Centre has been extended and directly funded. It was started as a research project. Now it's directly funded by the hospital. So it's a purchase service agreement between the hospital and Youth Opportunities Limited. We participate in lead agency working group. We participate in a broader part of the health and homelessness community, but we also have established a hub partner CEO meeting group where very informally the senior leaderships of the two CEOs in this case can meet informally and frequently to compare best practices, learnings from any gamut of issues that as hub partners we're going to find, whether that's service level, whether that's neighborhood relations, whether that's service delivery challenges, even informal relationships across our staff groups, so that we can look at, to Kevin's point, there's people that can fit into various hubs. If a young Indigenous person ends up at a YOU hub and for whatever reason, that person is better served in an Indigenous model, ensuring that there's good access and paths of care across both organizations. And as more hubs come on board, we're thinking that informal and very strong relationship across the people that are primarily delivering these services are comfortable and allow for a very easy and informal day-to-day transition and conversation. On to the next slide, Kevin. So what have been our initial findings and results so far, given that the beds did open on December 1st? Since December 1st up until you'll see January 8th on the slide, so there'll be updates here I don't have available right now, but we've served 17 youth. 10 of those 17 youth have experienced homelessness for longer than 6 months. In fact, I think 7 of the 10 were 12 months or more. So these are, even as young people, people that have experienced chronic homelessness and have not been able to adjust into a shelter or into other housing options available to them. We've partnered with already 8 external service partners, including, you'll see our Children's Aid Society. So we have people as young as 16 years old who had been sleeping rough, sleeping outside. Youth Opportunities Unlimited has partnerships with local anti-abuse organizations where we co-deliver programs around anti-human trafficking. So it provides a safe space and then also connections to London Abused Women's Center is the name of the organization, on over to Violence Against Women shelter beds when they're available, when they're suitable, and so on and so on. So it creates not only the intended partnerships that we've talked about through presentations from Kevin and Lynne, but then also unintended, in some cases, partnerships that as one of the hub partners we already have available and we can expand upon in our day-to-day operations. So this is a draft of where the permanent hub will be, where the 15 beds will be eventually, so the 6 respite beds. So as you're looking at this screen, and sorry for the quality of the image, you'll see it in the presentation later on. You can zoom in and so on. There's 9 individual rooms around the perimeter of the space here. The one larger room in the middle, that's the 6 respite beds that are being designed right now, along with those 9 rooms. And then where you see the red boxes and the perimeter on the outside, that's where there'll be some meeting space for our community partners. This is a building that already exists again on the London Health Sciences Center campus. In part, as we develop that partnership with London Health Sciences Center, the intentionality around that will be, how can we create specialized teams of support across our organizations that respond to the unique needs of these young people? So for example, if they need social work support, psychiatric supports, and so on, can some of that be extended as an offsite connection in this facility and or to the other facility that Kevin mentioned at Jones Place? At Jones Place, London Health Sciences Center will have a permanent clinic in this building, which will have attached to it 39 deeply affordable apartments that are set at maximum of 69% of market rate, along with all the other supports that YOU brings to the table and our other community partners. And the London Health Sciences Center clinic that will be there will be an opportunity to support folks that are coming through the hub program, folks that are in other states of need, and so on, with the idea that by spreading it out in that way, we're not anchoring people that have experienced long-term homelessness in any one neighborhood, because the idea is that as a housing provider, We want to ensure that we're continuing to move them forward towards a neighborhood and a place where they will call home. And as comfortable as the hub is going to be, as comfortable as even a shelter is, or as comfortable as some of the other transitional supports are, they're not home. And the point is, if we can help people get anchored in the supports that are around them, we can help them stay open-minded and stay focused on the goal around housing.
So I'll move into, so thank you, Kevin and Steve, for a great job on our hubs. And the other part of our plan is around highly supportive housing. So I'll just highlight some of our innovative partnerships that we have in place. The first is between the municipality and an organization that delivers supportive and highly supportive housing in Ontario, Indwell. And as of October, we were able to open 44 highly supportive units. As well, a very unique partnership that would not have happened had it not been for this work between a frontline homeless serving organization of London Cares and again, our large institution of London Health Sciences Centre, where they converted a former hotel. It has been funded between both organizations, no government funding to support this, and they opened 25 units in October. So it's these kinds of partnerships. We have another very innovative one that we'll be able to talk about very soon that will bring on an additional 50 units very soon. It's those kinds of partnerships that have arisen out of our collective work together. I can just go next slide, Kevin. So that kind of draws together how we're doing this. I did want to just, because given some of the questions in the chat, I just want to be clear that this is the work we're doing around those that require the highest level of support, the highest acuity. We have an excellent base system that supports very well people of low and mid acuity in our community. We are a net zero homeless community for veterans. Who we weren't serving well, where it was broken, is those of the highest acuity, banned from service, no supports. That is the group we needed to focus on. That is the group that had the biggest draw on healthcare resources, emergency responders, effects to business. So I don't want people to think, oh, where is everybody else? They are being supported. This is new and what we're doing differently to try and deal with that group of 600 out of our 2,000 that experience homelessness in London. Just go to how we are making this happen in terms of the money, because that's always the key. And essentially, we say it takes all of us. So we need funding from every level of government. And our first hubs, we are supporting and highly supportive housing. We are funding through existing operating dollars through the municipalities. We receive transfers from the province for some of that funding. Some of it is municipal dollars. We are also very fortunate to be the first city in Canada to be able to access the Housing Accelerator Fund. And within that fund, it has a broader mandate, of course. We built in hubs and highly supportive housing. So some of that funding can go towards this work. I will say we are working very hard right now to try and access operating dollars from the province. Not quite there yet, but we're hoping that that will be soon. And then, of course, we have this amazing family in our community that has donated 25 million with a commitment to match up to 5 million in raised funds. And this is also what we believe is different. I've been around a long time and I have not seen an initiative where you have government, community, and philanthropy coming together to support and deliver on a system and the people that are most vulnerable in our community. And that is what is happening here in London. So we can go to the next slide and I'll turn it over to my colleague, Diane.
Okay, hi everyone. Yeah, I just kind of want to build on what Lynne just shared there about the anonymous donor. I want to take a step back and give you some context of how this all came to be. So the donor family, long history in London, and saw the rapid decline in the status of our downtown especially. And they saw a lot of suffering, and they're generous donors to many agencies across the community, but they wanted to do something transformative. And if you remember what Kevin and Lynne had shared with you up front, these community conversations were starting in November. Well, the donor family really only was made aware of this in December. So it was really in the first part of January that they put their money to this. and pledged 25 million plus a 5 million community match campaign for a total of 35 million. Now, I want to acknowledge this significant amount. Typically, this kind of money goes to universities or hospitals, which is amazing. And of course, good work happens out of that. But to have this kind of endorsement when there wasn't yet specifics, or we didn't have really anything to truly demonstrate a hub already in place, or this model of highly supportive housing, this was all being developed. We have to acknowledge the fact that these donors were demonstrating trust-based philanthropy, right from the start. The other thing that they did, they certainly could have gone at this alone, but they knew they needed a partner, which made sense for them to work with the Community Foundation, because we have the knowledge and expertise of the sector. We can understand the realities and complexities that goes along with this work. And I'm going to be very candid with you. Since January, and as this work was being developed, it did get quite a bit of media attention and oftentimes not the best press. And so that was our job as a community foundation, to really keep the donor engaged, understand what the noise was all about, and really what was the real work that lied ahead and the opportunity. So our role was really working closely with the donor family and the city in terms of just liaison, making sure that we were informed along every step of the way. And I also want to take a little bit of a step back and also disclose another reality. When the donor family wanted to do this 5 million match campaign, we, as a typical foundation, we would say, you go on your own and you make this happen. And so the family did try to do that on their own, but for whatever reason, it didn't work out. So they turned back to us, and knowing that this was so important to our community, we were willing to step up and help the donor family form a fundraising cabinet. But bear in mind, as a community foundation, we're not to be competitors to our charity friends in the community. So we were very mindful of this, and we made it very clear up front, like, what's the rules of engagement here? We knew that we wanted this to be a short campaign. We knew that we needed to be very strategic to reach that goal, and at the same time, not appear that we were cannibalizing or taking the air out of other charities, because they were still doing the good work and the hard work in the community. And so we were very intentional with this. So I'm proud to say that from September till the close of December, the committee raised 4.1 million. So we're not far from that 5 million goal, but we were committed and able to raise a lot towards this. The other thing that we do as a foundation is we're providing governance and stewardship to the fund. So from a community fundraising perspective, the community felt confidence knowing that it was in a safe place with us. Oftentimes there was misconception that they thought the fund was held at the city, and the city didn't want to deal with that. And of course, they just didn't want this to be messy. So it made sense to have it at Lynne Community Foundation, and we provide that governance, oversight, and stewardship every step of the way, as long as the fund is in existence. So that's my part.
So with that, we'll close out.
Sorry, I just want to add one more thing. I'm sorry.
After Diane says one more thing.
Well, I think you've already touched on this. I can't underscore how much of an opportunity this is when you do marry philanthropy and the government and the community together. And the other thing I want to point out real quick is that this community element was able to start up front in November, regardless of the money. But the money ended up coming in January. So I just want to say that it really does lend some leverage, and it does support the sector in trying to mobilize and get this going. So that's it. So go ahead, Lynne.
No, that was great, Diane. And so I just want to say thank you to everyone for the opportunity to present. We do have a short video to share with you, and then we'll turn it back over. His voice was. We felt that Erica's voice was more important so that you could hear some of the early impacts about what's happening in our community. So again, thank you very much for the opportunity. We'll turn it back to you.
Thank you so much for that incredible, informative, and engaging presentation. I really appreciated the variety of perspectives. Transformative change indeed. So we're going to dive right in to that and spotlight our great community response panel. So that's Leah, Krista, Sylvia, and Hillary, alongside our London speakers. So just give you a bit of context in terms of how that'll work. Each of our respondents will share a brief initial sort of response to the model and their perspective, and then ask a question of the panel. So we'll give each of the community respondents about 5 minutes. I think that should work, including responses from our London folks. So we really appreciate people being as concise as possible, despite the fact that I'm sure you have many thoughts and ideas that you'd like to share. So Leah, if we can begin with you, we'll just turn it over to Leah now.
Morning or afternoon, everyone. Thank you. Wow is what I have to say, actually, after that presentation. I'm really impressed about the timeline, first of all, of getting everyone together, all the stakeholders together, getting the idea put into place, and then actually actioning that and bringing those hubs online already to where you are from where you started. So very impressive. I really, I was struck by you have the same number of unhoused folks as we do with a different population. So I really see similarities there. And a lot of, what we're faced with, the folks that we are seeing, most vulnerable folks are the ones with the most acuity as well. So I applaud you for really focusing on that. I know all of us agencies are working hard to, support those that we can. And then sometimes there's those ones that we still are, struggling with. So bringing all the stakeholders together and finding solutions to really focus on that. I think that's fantastic. I do have a lot of operational questions. That is my role. I run supportive housing and shelters, and a lot of the work I thought I heard from the hub is really connecting folks with those services. So operationally, I see some similarities. Specifically, I really love the idea of having that one number, that central intake spot for the whole community. So I guess my question, I'm maybe Lynne would go to, is just about bringing that coordination through, to the hubs through the whole community. How did you start that? I know you said you did the sessions, but how did you get the buy-in from everyone, and how did you get everyone participating in that?
Yeah, so we two-stepped it. Thank you. We two-stepped it. Initially, in the summer, I started a conversation with the heads of our 2 hospitals, the head of police, the head of our health unit, head of EMS, head of our mental health organization, because I wanted to change the frame to a health conversation. When we talk about it just as a homelessness conversation, it becomes a municipal problem, and only a municipal problem, and our stretched social service organizations. So we're trying to change it. So by bringing that broader community leadership to the conversation, that started it. And then I'll be frank, we had an exceptional facilitation team who had deep connections across the community. The city was not a trusted partner initially. We were not a trusted partner. I could call a meeting, but in order to actually have credibility, and we needed to rely on others and build that trust as we went. So we had this amazing team that was able to help us. And then we relied on key leaders like Steve, who were able to be very important in our summit discussions to kind of bring people to the conversation, talk about what was most important. And I think the other thing that really helped us is we had frontline in the room. And man, did they make sure that we were talking about reality. And so those were the things I think people started to have, because people came into it with a lot of cynicism. Like, are you really, this would be another thing we've done, right? And we had key leaders and along with other voices who were able to say, no, this is feeling different. And I guess the last thing I'll say is I think because we've moved with such incredible pace, people are like, okay, this is a thing, we're going to do it. And we still have that number of people coming to our meetings.
Great, thank you.
What a great question, Leanne. Thank you for that insight, and thank you for your response, Lynne. Now I'd like to move over to Krista to share her thoughts and certainly address a question to the panel.
Okay, thank you. And thank you for the presentation. It was illuminating. I am going to start referring to this as a health and homelessness crisis when I speak about it with community and council, because that is really important. And I think in our region and Victoria specifically, that is the piece that we're missing, is that health component. And so what I'm seeing here is really these hubs are specialized, thoughtful, really well-functioning shelters, which we don't have at all. And where we're moving to, the conversations I'm hearing, and I think what's going to start to come to fruition in Victoria are tiny home communities. So my question for you was there any conversation about, so I'm going to call it almost a movement of these tiny home villages that seem to be happening all over North America, and the decision to go with hubs over villages or tiny home setups?
So I'll start, if that's all right, Krista, and then I'm gonna have Kevin and others help me, but we're both and, right? So hubs
Okay.
are really meant to be that, let's get you come inside, because these are the folks who've lost total faith in the system, right? Aren't really wanting to be engaging. So let's try and get folks to come inside, and that may take a bit, and start to stabilize. And then when they're ready and in a place, we can talk about housing and get you to housing. So the hubs are that kind of transitional place. They're not meant to be, as Steve said, home. The other side of our equation is trying to create that highly supportive housing, and that may include tiny homes. We just did an RFQ, request for qualifications, to kind of get a sense of the range of ideas that are out there. I'm expecting to see something like that come back in. But it can range from the two that we showed you, which is a new build, resulting in highly supportive units, to converting an old hotel to highly supportive units, to potentially tiny homes in a highly supported way. So it might be that range. I don't know, Kevin, if you want to add something to that.
The only thing I'll add is that when we worked as a community to design the standards and the core functions and where should hubs go and where should they not go, one of the things that was resounding from a number of parties was, can you put me in a spot that's still close to other services, that's close to major transit routes? I want to be on a transit corridor. That's where these hubs should be. To move to tiny homes for that service, we're going to run into a land problem. We didn't have a lot of vacant parcels of land that met the criteria that those that are wanting service, those that are delivering the service, and those in the community were expecting us to deliver. So that was a disconnect for us. That might be very different when it comes to the housing side, but for the hub side, we're really looking at existing properties, existing buildings that could check a lot of those key boxes for people around that transit corridors and close to other amenities and services. And we just couldn't get that with tiny homes.
Yeah, I don't really see tiny homes as being permanent housing either. Like, it is a transition, but I like the idea that it's not one or the other. We could have hubs. We could also have tiny home communities. We can also be working on affordable housing. And I just wanted to mention one thing for the people from, most of us are from Victoria on this call. We did have one real success story that I want to highlight, and that's that we had a shelter open up. It was supposed to be an emergency weather response shelter, but it actually opened every night for the winter, and it's run by an organization called Solid, which they're a peer-based organization who only work with low barrier people. So we have that here too, that same challenge with the high acuity cases. And I'm thrilled to let people know that there's been no issues at St. John the Divine Shelter with Solid. So I'm wondering if I could have another quick question, if there's time. Have you worked with peer-based organizations for your high acuity homeless individuals in the hubs?
I'll start that, and Steve may want to weigh in on some of his experiences. So we don't really have, one thing that we lack is like a really well-established peer organization or a peer service in our area. It's part of our whole of community system response, part of that collective impact model is to work with the community to start to establish a peer-led reference table, start to create that peer council that can help inform this process in a more formal way. Right now, we've been going out, we've been providing, we've been compensating people with cash for their insights and their ideas and providing input. But we really want to formalize that into a more peer-led group that can provide a little bit of governance to this thing. And it is one area we lack. Now, that being said, many of our organizations that exist in London have done an exceptional job of hiring people with lived experience that have been service recipients and are now service providers. And they come to all of our implementation tables and they're informing this plan. And so they bring that firsthand experience, but now they're actually paid employees of these organizations. So it's not a like for like, but we do benefit from that type of knowledge throughout a lot of the organizations in the community.
Great.
And I will touch on that briefly, and that there's time, Shelley, and that is just to say that in our shelter, in our hub location, we wouldn't see a strong peer staff model, but in terms of our services across our, we have something called the Youth Wellness Hub initiative in Ontario, which is built on the Foundry model in part in BC. So some of you will be familiar with the Foundry. So you'd be familiar with the kind of programming that would happen through that. So we have that kind of programming within Youth Opportunities Unlimited, which is very actively peer-based. So there'd be opportunities for folks from the hub, from shelter, participate in peer-led programming, but not at the hub, not at the shelter. But to Kevin's point, for our delivery staff, and particularly on the housing side and a lot of the other community support side, about 25% or so of our staff are would be seen as people with lived experience. So it's what's driven them to the sector, and so they bring that lens.
Great, thank you so much. I think those are really, really important questions, and the peer piece, I think it's just immensely valuable. And you're already changing our language locally, so that's wonderful. I'd like to now certainly roll over to Sylvia for her comments and reflections.
Thank you very much. Thank you for your presentation, and I applaud the work that you've been doing and how quickly you've been doing it. And a lot of it resonates with the work that our organization has been doing in community. And I would like to have an opportunity to further conversation so that we can share our experience with you and lessons learned, etc. I also want to thank you for shifting the conversation from homelessness to healthlessness. And we certainly have done this in the region. And the Alliance itself has a health and housing steering committee that informs the work that we do in community to ensure that that health lens is provided to all of the homelessness piece, and that we don't disassociate one from the other. I also appreciate, the transitional piece of what you are doing with the focus of implementing roads into permanent housing, and I applaud the fact that such a substantial funding model has been put in place in order for that to happen. As someone said earlier, the funding piece is always crucial to the ability to be exponentially impactful. My question is around reaching home funding. As there is that piece in our communities with the federal government for reaching home funding, and how that is implemented in community through the community entity to help with the different pieces of solving homelessness through the reaching home funding directives. How do you intersect your work with reaching home funding and the CE?
Thank you. It's a great question. We really benefit from our reaching home funding. We've been able to apply it in a number of different ways. Our community advisory panel, our London Homeless Coalition, they help us direct and guide where that reaching home funding goes. We've been able to apply it to a number of different housing initiatives. The reaching home funding is often really well suited for capital projects, but we've been able to stretch it and use it for things such as temporary cold weather response, so a one-time investment to scale up our shelter system and temporary indoor resting spaces and overnight resting spaces for the coldest months of the year to try and flex our system by an extra 225 beds. So Reaching Home has been really impactful there. It's also been able to help us use it for some bridge funding on the hub side, but predominantly we like to use our Reaching Home in some of the capital and housing projects, be it through some of the land acquisition or through some of the capital construction costs. We do, however, try to strengthen that relationship with the federal government. As Lynn mentioned, we are a community that has reached functional zero for veterans homelessness, and we really try to pride ourselves in demonstrating back to the federal government how impactful and how far their Reaching Home dollars can go. We did receive an increase in our allocation of Reaching Home funding just recently, and we've been looking to make some targeted investments to keep the whole of community system response efforts through highly supportive housing and through the hubs work going through those resources.
Lovely. I applaud you.
Thank you so much for the response, Kevin, and for the really important question, Sylvia. I was thinking actually about that same question myself. And now I'd like to turn it over to Hillary. Thank you so much, Hillary. I'd like to hear your question and your reflections.
Hey, good morning, good afternoon. It's so wonderful to hear that presentation and see everybody and connect. And as a lived experience person and a person who's worked in this system for decades, I have good thoughts and I have bad thoughts of the hubs. And I just see kind of repetitiveness in kind of the work that we do here in Victoria. We have a lot of organizations that are doing practically the same thing. And we are trying to streamline the HIFIS so that we can have that one number and make it easier for people to connect. But I have a curiosity around life skills and peer support, and how, you know, we have people that have been so enmeshed in homelessness without health, and where do we start in life skills and education to create a better place for themselves? Like, how do we instill it within people to do for themselves, to move from one step to another? I feel like we're just creating another job for outreach workers or another job for agencies, or like we're just creating more employment in these hubs to assist people. But yet we're not creating education and the life skill and peer support that they can move to the next step. And where does the transitional, when they're done transitional, where are they going? Does London, do you guys have a whole pile of affordable housing that's right there ready for people to move right into? And another thing that I noticed when I was reading the report, that the hubs, some of the hubs, because it's the high acuity, they can't be near children, they can't be near schools, they can't be near daycares. But then you want to integrate them back into the community, but yet the community doesn't want them. So to me, that's a real, that would be a battle for sure, to get people integrated into the community. And my other point is all about substance affected people, and how are you doing the wet and dry, and how does that work? Because I know here, BC Housing bought a lot of hotels, and people were pushed into hotels, and it was more about just, you know, putting people into places without actually checking the safety and drug use and alcohol use and all of that. Yeah, so I'm going to stop there because I know we're coming into time, but those are my thoughts, and I really appreciate the whole thing that you're doing in London, and any step is better than no step. So congratulations on doing something that's really, really cool.
Thanks so much, Hillary. Maybe that, Lynn, and maybe
yeah, sure. I'll
yeah.
start, and then I'm probably going to turn to Steve on the life skills part. But so a couple of things. One, the whole idea is that that's why we're having to build the highly supportive housing. So we, like every community, is struggling to have enough housing for anyone. And for this group of folks, we don't have nearly enough of the kind of housing where people need those supports to be able to learn those skills and then perhaps move to other levels, more independent, less support housing. So that is why it's part of our plan. In terms of, we take a harm reduction approach, but also what is new and different about this approach is we have very clear standards. So we've come from a place where each organization might do their own thing. And now we have very clear standards about what all of those functions in a hub, how they're delivered. How is safety addressed? If it's harm reduction, where can someone use in a space? The answer is only in their private space, only if they're using it all. So those are, and some spaces may be different for different populations. So the standards are really important to be able to change the dynamic within the space. And that's another critical part that is different. I appreciate the questions. There's so many layers of detail to this work, but I do want to just give Steve a minute to talk about the life skills piece.
Thanks, Lynn. Thanks for the question. And absolutely, there's no perfect answer, and I'm not sure there's going to be a perfect answer here either. But just to give a sense of the living and breathing of how that works. So for us, we've been a shelter provider. Our youth shelter opened up in 2020, so during COVID. Prior to that, the shelter was delivered through the youth beds were part of a large shelter in London. And even during the pandemic, they were, often a third occupied, 2/3 not. And it wasn't a lack of demand. It was finding a space that was comfortable for that particular population, in our case, youth, right? So, and where they felt safe, they felt respected, they felt they could build upon. And so as a shelter provider and also a hub provider, we bring that lens of creating that space where first, feel safe. First, feel welcome. Don't worry about there's a clock ticking, you got to go, because you don't. You keep working on a plan. We're going to keep working with you. And to say there's a formal life skills program, there's a formal this, there's a formal that, I don't see that happening. But for folks that are struggling in their day-to-day living, their day-to-day experiences, everything for, most things become teachable moments. And how do we help support you in staying on the plan you've agreed upon? Our connections with other hub partners and other partners in the community, where there's opportunity through London Health Sciences Center to bring, for example, family reunification conversations. For youth in particular, we think that's a significant path out of homelessness. There almost always are families that, whose hearts are breaking, that a son, daughter, child, grandchild, niece, nephew is homeless. But that doesn't mean there's an empty bed waiting for them to move back in full time. A lot of trauma, a lot of dysfunction happens in between that. We're hoping, in part, our healthcare partners at London Health Sciences Center, at CMHA, and so on, start bringing the lens of those family reunifications. It's not our mandate, but we want to facilitate the process so that organizations whose mandate it is bring those talents and those resources and those skills. On the other side of the life skills piece, part of our role is integrating into like the Youth Wellness Hubs Ontario initiative, other programming that Youth Opportunities Unlimited. We have a teaching kitchen, and we've integrated our hubs model very much into the breadth and the backbone of what Youth Opportunities Unlimited is all about. So it's not about the 15 beds here and so on. I think sometimes our council was underwhelmed by the number of beds that Youth Opportunities brought to the table. What we also bring to the table, though, is that we're working towards a throughput of 90 days. That doesn't mean no one's going to go over 91 days, and it doesn't mean everybody's going to stay for 90 days. But it means we're hoping to have a plan in place that within 90 days, you're in a place and you're stabilized and you're ready for that next step towards housing. And you might be ready much, much sooner than that. You might be ready in days and weeks with other supports. So that's kind of the way it'll unfold, and connecting with our partners in Indigenous services and how to incorporate that. It's of course a significant part of our homeless population. I'm sure it is in Victoria as well. And how do we connect with those folks so that the life skills and the culturally sensitive pieces that need to take place in the right place, in the right time, and so on. I hope that's helpful.
Absolutely. Yes. Thank you so
Thank you.
much to all of our amazing speakers and everyone who speaking on the topic today with so many insights and lessons for us to take forward. Certainly, I think there's going to be, based on the chat, a lot of dialogue that continues. And I think we could probably all talk about this all day. And it says a lot about how important this issue is to all of us here today. And I want to let you know, we'll be putting together a backgrounder on this event to share in coming weeks. This is just really a starting point for this conversation for us, and how we can build upon this important work and advance it in our community. We want you to subscribe to our newsletter, of course, and we have all that important information in our chat. So before everyone disappears, I want to put a shameless plug in for our upcoming events. On Monday, we're hosting a closed learning session for city councilors in our region on the recent changes in provincial legislation. So you can even email events at Community Council from your city email address for more information. And then our AGM, we've sort of planned a really fun night. That's Tuesday night, if you're in Victoria, from 5 to 7 at the Victoria Event Centre for trivia and discussion on fostering hope and curiosity in a polarized world with Yute Lee of About Here. He's a very popular urbanist YouTube channel that you've probably heard about. And so we're going to have opportunity for some drinks and local made tamales for purchase. And please reach out to events at Community Council, Michaela, who many of you met at sort of working behind the scenes to get more information. So unfortunately, that's all we have time for today. I want to thank everyone. Thanks to our community partner, United Way of Southern Vancouver Island. As always, it was amazing having you here. Our panelists, our incredible community response panel, and of course, everyone else for joining us. A more integrated system is a more responsive, effective, people-centered system. And London model is an example of how a community is getting service system integration and homelessness response right. We're grateful you could all be here today, and we encourage you to continue this and other important dialogues in your community. All right. Bye, everyone. Thank you.